Okay, we're on the air. Thanks everyone for that. Martin Gately, the clerk to the meeting, will now provide the attendance and apologies for absence, including any deputies later during the meeting. Martin, please. Item 1 on the agenda is the minutes of the last meeting. Everyone will have had that as a pre-read. They're on pages 3 to 9 on your agenda pack on the blue pages. Our last meeting was Wednesday, the 2nd of September, seems a long while ago now. Can the minutes be approved as an accurate record of the meeting, please? Anyone against? Anyone abstaining? Assent will therefore be assumed. Thank you. Martin, please.
So, Chairman, the apologies for this meeting that I've received are Jonathan Gribbin, Nottinghamshire County Council, Colin Pettigrew, Nottinghamshire County Council, Dr. Tillan Bartholomew's, NHS Nottingham and Nottinghamshire Clinical Commissioning Group, Lucy Dadge, NHS Nottingham and Nottinghamshire Clinical Commissioning Group, and Idris Griffiths, NHS Bassett Law Clinical Commissioning Group. Thank you, Chairman.
Thank you. I also required to ask county councillors if there are any substitutes present. From the county councillors, are there any substitutes present, please? Thank you. Jeremy Griffiths, you've got your hand up.
Yeah, thank you, Councillor Harper. It was just in relation to the minutes on page 9 of the minutes. I'd requested feedback from the Director of Public Health on the replacement of Public Health England with the National Institute for Health Protection and the implications for our work programme. I just wondered where that feedback potentially, how that feedback potentially will come back to us as a board.
Right, thank you. Unfortunately, there's no one from Public Health here today, but I'll sort that out for you and ensure that you get that.
Sorry, Councillor Harper, I'm on the call. So I can at this moment, Jeremy, we're not in a position to understand the full impact of that. So you'll appreciate that we're receiving delegation of some duties from Public Health England and the NHS into local public health services weekly. But in terms of the formal proposals about the future Public Health England, there is nothing certain about that proposal. So there is nothing for us to report on in terms of the work programme at this time.
Okay, thank you.
So I'm Melanie Brooks, Corporate Director for Adult Social Care and Public Health. I apologise, everybody. I forgot to introduce myself. My apologies.
Thank you.
Thank you, Melanie. How could anyone not know you? We'll start off with a COVID-19 update, and as members are likely to have seen in the media in Nottinghamshire, there's been significant increase in the positive COVID-19 cases over the last few days. A number of Nottinghamshire County Council colleagues, normally represented at the Health and Wellbeing Board, are currently involved in outbreak control. We're mindful that colleagues in other organisations may also have similar commitments. So we'll therefore seek to conclude our business at today's meeting in a timely way. And please bear with us as there are no one from Public Health apart from the Corporate Director of Adult Social Care and Health. Just to give you a brief update, Nottinghamshire Council stand together with City to urge people to follow stricter guidelines on COVID-19. And I'm pleased to announce that all county, district and borough councils are working together and have added their support to the City Council to urge people to follow stricter guidelines to help stop the spread of COVID-19. There continues to be increased rates of positive cases of COVID-19 across Nottingham and Nottinghamshire. The rates across the county currently vary between 53 and 150 per 100,000. The rate of infection for Nottinghamshire County Council, Nottingham City, which currently sits at more than 400 per 100,000. The government's threshold for concern is currently 80 per 100,000. We're expecting the government to make an announcement tomorrow to indicate if additional restrictions and measures will be introduced in Nottingham and Nottinghamshire. We don't want to wait for that, so we're asking everyone who lives in Nottingham and Nottinghamshire to not mix indoors with people from other households. COVID-19 does not recognise geographical boundaries, so we must stand together with our local authority partners to do all we can to fight this virus across all our communities. And we can act every day to tackle COVID-19. And it's a phrase that's being bandied about that's well known now: hands, face, and space. We'll now move on to item 3, declarations of interest by members and officers. So do any members or officers have any disclosable pecuniary interests or private interests, pecuniary or non-pecuniary, to declare? I've not seen any hand up, so I'll take that as no. As I always say at this point in the meeting, it's not a problem if you do suddenly recognise something in the agenda, then just shout up then and let us know. We'll now move on to item 4 on the agenda, which is the Chair's report, and that can be found on pages 11 to 18 in your pack. The recommendation is to consider whether there are any actions required by the Health and Wellbeing Board in relation to the issues raised. So to debate it, I will move it. Could I have a seconder, please?
I'll be happy to second that.
Thank you, Councillor Ostens. The Chair's report provides a summary of local and national issues for consideration by board members, and we'd like to highlight the following sections. Page 11, 2020 flu campaign. On page 11 of the papers, there's a reference to the 2020 flu campaign. Arrangements are in place with partner organisations to support the uptake of the NHS flu vaccination. Members may have seen reports in the media about a potential national shortage of flu vaccines, and we'd like to reassure members that supplies of the vaccine are being prioritised for people who are clinically at risk. A list of people who are eligible for the flu vaccine is available on the NHS website. These includes people who are 65 and over, have certain long-term health conditions, are pregnant, are in a long stay residential care, receive a carer's allowance, or are the main carer for an older or disabled person, live with someone who is at high risk from COVID-19, i.e. they're on the NHS shielded patient list, and frontline health or social care workers. Any person who falls within one of these groups should receive their flu vaccination, and we can assure that no one who is clinically at risk should be turned away. And it's our understanding that those who are unable to book appointments for the vaccine are people who are not clinically at risk and are requesting a vaccine privately. This is happening because supplies of the vaccine are being prioritised for people who are clinically at risk. 50 to 64-year-olds who are not clinically at risk will be contacted about a flu vaccine later in the year, once those who are clinically at risk have been vaccinated. On page 11 to 12, Adult Social Care Coronavirus Winter Plan, there's a reference to the Adult Social Care Plan. This was published by the government on the 18th of September in response to the recommendations made by the Social Care Task Force, and further information of which is available on page 2 of the report. The Winter Plan covers 4 themes, including preventing and controlling the spread of infection in care settings, calibrating across health and care services, supporting people who receive social care but also the workforce and carers, supporting the social care system. The plan contains a number of actions for local authorities, and it has a clear focus on care homes. There are a number of actions for providers, and local authorities are expected to have assurance that providers are fulfilling these. A key focus for Nottinghamshire County Council will be to ensure care homes are well informed about the local infection context, that we work with providers to build COVID secure visiting arrangements, and that we provide professional support to enable decisions to be made that balance individuals' rights, choice and control, and the rights of others to stay well. Page 13 to 14 is an update on the Child Obesity Trailblazer programme. And as many of you may know, Nottinghamshire County Council are one of the 5 local authorities nationally to be selected as part of the government's Childhood Obesity Trailblazer programme. Our focus in Nottinghamshire is on the food environment in the early years sector for children under the age of 5. This currently focuses on areas with higher levels of obesity. The aim of the work is to make it easier for people to access affordable and healthy food, improve the quality of food provision through early years settings, and help parent and carers to develop good eating habits with their children. Despite the pandemic, progress has been made in a number of areas, including nutritional guidance for early year settings, which has been incorporated into menus and recipes from Nottinghamshire County Council School Meals Service. 262 early years providers have been engaged in assessing what support they would like to improve their food offer for children. 2 working groups have been established in the children's centres where initial work is focused, i.e. Ravensdale in Mansfield and Harworth in Bassetlaw. Work is underway to raise awareness of the National Healthy Start scheme, which enables pregnant women and families on certain benefits to obtain vouchers for healthy foods and vitamins. Awareness raising of the scheme has taken place across all district and borough councils, primarily through establishing links with district and borough councils' health and wellbeing officers and partnerships. The next steps include further development of a food club model with Family Action, working with the Soil Association to offer a Food for Life award with 6 early years providers, implementing a Healthy Start promotional campaign, reflecting changes to the scheme at a national level, testing the school meals supply chain with 3 different early years settings and a recipe bag concept, and deploying specialist early years nutrition e-learning to frontline practitioners across the early years sector to provide families with a consistent healthy eating messages. As you can see, although everybody's been involved in the pandemic, a lot of work has gone on and continues to go on, and we thank all the officers concerned in that. There are a number of other subjects in the report that may be of interest. Would members like to raise any of these subjects for discussion? And in line with the recommendation of the report, are there any actions required by the Health and Wellbeing Board in relation to any of these issues? I've just been informed that Councillor Fisher, you would like to speak on this subject, please.
Yes, thank you, Chair. Can everybody hear me okay?
Yeah, you're fine.
Thank you. Yeah, it was just to talk about, I mentioned in the last meeting about the flu vaccine and a campaign that I was going to do in Mansfield to be videoed. That's not happened yet. It's still being set up with my GP to have it done at the surgery or wherever it's convenient for them to continue that. So I just wanted to update you on that. And I think you've been notified that I've got to leave early, so I just wanted to raise something with you as well, if that's all right, Chair, if this is an appropriate time.
Yeah, that's fine. That's okay.
Thank you, Chair. I've come across a young woman, a woman that normally gets her prescriptions delivered to her from her local chemist. But unfortunately now, most chemists are charging for that service. So I wanted to raise that here, mainly because people that normally have them delivered are probably the most vulnerable, either elderly or disabled, excuse me. And the cost of that would be, for one person, £30 for 6 months. So that's £60 a year, theoretically speaking, or £45 for 6 months for a family, which probably doesn't sound a lot, but it is to some people that are on low incomes, and especially with what's happening with the pandemic. And I just wondered, Chair, if it was okay if we could have a piece of work done and something done brought back here to see what impact that's having on people, if any.
Yes, thank you. We'll raise that in the work programme and include that in it. So thank you for that. That's a really good suggestion. Thank you. I've got Councillor Bosniak. Joyce, please.
Right, you can hear me now.
Yeah, we can hear you,
Yeah,
Joyce.
fine, that's okay. I know that people need to go early for obvious reasons, but I just want to ask a question on page 11, and it's to do with the new package to support and enforce self-isolation. And I don't know whether you can answer this or not, but it talks about that it's been available since the 28th of September for people who have been told that they've got to self-isolate. I just wonder what the mechanism is for that, and who is responsible for informing the individual that they're eligible for this payment. So just some ideas about the mechanisms, and is it starting to work yet, or is it something that we say we're going to do but hasn't yet started? Thank you.
Tony, you're on mute.
Sorry, thank you, Melanie. I was just about to introduce you. Is this something you would be able to answer?
I thought you might be able to. So thank you, Joyce. The district and borough councils are responsible for administering and promoting this scheme. So in the county council, the only responsibility we have for grant funding is the infection control grant for the social care market. And you know, I think you know in your other role as in Ash Committee quite a lot about that, but this scheme is solely within the district and borough councils' responsibilities. And I'm really sorry, but I don't, other than that, Joyce, I don't have anything to share, but I don't know if there are other colleagues on the call who may be able.
Yeah, because I would still like to know whether people are accessing that or not, regardless of who's handing it out.
Yeah, thank you, Joyce. I'll move on to Dr. Jeremy Griffiths, who may be able to help, but he's also got his hand up as well. Dr. Jeremy Griffiths, please.
No, I'm not going to be able to update any further, but it was just in relation to just an important development, really, that's linked to the Health and Wellbeing Board at this crucial time as a huge challenge for us from a health perspective and also from a society perspective. During the pandemic, one of the most important things is the ability to share information, and it was just a suggestion, really, that we may. I think we would benefit from a Health and Wellbeing Board to be aware of the developments through the connected knots, the technology, information technology body that exists across Nottinghamshire, about the systems, the what's called the Health and Social Care Portal, which will enable providers of health and social care to be able to actually access better information on each other's systems. That's potentially a game changer for the care of our population, and I would encourage that as part of our work programme that we get an update on what's going on there, because I think that will help people to break down some of these silos that hopefully the Health and Wellbeing Board can drive further away from Nottinghamshire.
Yeah, thank you for that, Dr. Griffiths. I'm sure Ed will have made a note of that, and we'll raise that again in the work programme. So thank you for that. The next person with a hand up is Susan Shaw, please.
Oh, hello. Joyce, we did have a cabinet meeting in Bassetlaw District Council on Monday about this, the funding, and it's massively complicated. You know, the headlines are brilliant, but trying to find out how we help and target over 2,000 people with this funding, it's a massive challenge for us all, as it will be in every district. But we have got, as was said, we have got the job to do, and we will be doing it. But it's starting to flow through the system already, so people are getting it. But it's very complicated, as in, you know, the structure of it and trying to work out if they're allowed it, what they have to provide to get it. You know, it's so for the officers in the council, it's already, as we know, in every district council, the capacity issue, and it's even more so now we've got this added responsibility. Anyway, but we are on it. So
thank you.
And the other thing, can I just say, sorry, the other thing I wanted to say before that was that at the last Health and Wellbeing Board meeting, I heard about the video for promoting I thought the flu jab, and I thought it was a great idea. And I have actually done that with colleagues. So thanks for that. We got ours done on Tuesday, so it's not out yet, but we've done it. But thanks for that idea; it was brilliant. Thank you.
Thank you. Yeah, it is important to promote the flu jab, and I've asked for it to be put on the front page of the County Council website. And I went a couple of days ago, and a photographer turned up and showed a picture of me as the needle went in. So that's not a good photograph, but it's good that we're publicising it. So thank you, Susan. Dr. Jeremy Griffiths, please.
Oh no, sorry, the hand wasn't lowered. Sorry.
Oh, it was a legacy one. No problem. Any other hands or anybody else got anything to say on this subject, please? No, thank you very much. I read out the recommendations earlier. Anyone against the recommendations? No. Anyone abstaining? No. Therefore, I'll take it as read that everyone's in favour of it. So thank you very much for that, and thank you for all your comments and feedback. So we'll now turn to item 5 on the agenda, which is the engagement and communication strategy. It's a paper by Luke Barrett, who is the Group Manager for Communications and Marketing with Nottinghamshire County Council. The recommendations are to identify actions that member organisations of the Health and Wellbeing Board can take to strengthen communications in relation to COVID-19. So it's very topical at the moment. To debate it, I'll move it. Could I have a seconder, please?
Yeah, I'm delighted to second that. Thank you, Chairman.
Thank you, Councillor Rostons. So Luke Barrett, Nottinghamshire County Council's Group Manager for Communication and Marketing, will talk us through the COVID-19 engagement and communication strategy for Nottinghamshire. Our organisations all have an important role to play in warning and informing the public about COVID-19. As Luke takes us through the report, I would like you all to have the recommendations in mind. Are there actions that Health and Wellbeing Board members can take to strengthen communications in relation to COVID-19? So that's the recommendation. Over to Luke. Luke, please.
Good afternoon. Thank you, Chairman, and good afternoon, members of the Health and Wellbeing Board. Thank you for asking me along to talk to this report. So for those who don't know, I'm Luke Barrett, Head of Communications at Nottinghamshire County Council. Although I think my current role is Head of Outbreak Control Communications Planning, because business as usual seems to have taken a bit of a back seat. So this strategy was developed at the start of local outbreak control plans, when the government asked local authorities to take on a responsibility for local outbreak control planning. And so this predates a lot of the learning we've had since this document was pulled together. But what it does outline is a very high level and simple overview of our approach to communications. What it doesn't show you is everything that we've been doing and all of the challenges that we've encountered from a communications and engagement point of view since the start of the pandemic. And I would ask Mr. Chairman, if it's possible at a future Health and Wellbeing Board, if I can bring some of those examples to this board to showcase examples of what we've delivered, instead of just the strategy in its own right. The strategy is fairly self-explanatory, and I hope that members have had the opportunity to look at it. And if there are any questions, I will answer them here. But I think what might be more pertinent to this group and possibly add some value would be is if I showed you some examples of the work that's been taking place and the way we've been engaging with our communities across Nottinghamshire.
Thank you, Luke. I've got Sarah Collis from Healthwash. Sarah, please.
Thanks, Luke. Are we going to give us some examples? I'm sorry, I wasn't sure if we were interrupting your...
No, not at all. I think my proposal, Councillor Collis, is to bring those examples to a future engagement,
Right.
future Health and Wellbeing Board, which I'd very happily do. I can give you an overview now of the challenges from a communications point of view and the way that we're organising ourselves to manage the pandemic from a communications point of view. I think the key point to raise will be that working together with our district council and the council partners is the only way to succeed through this pandemic. And we've achieved great success through the outbreak control cell. And as you will know, there is a huge mechanism in place to manage the pandemic centrally from public health teams here at Nottinghamshire County Council. I'm very proud to be part of that experience and that journey in helping to manage the pandemic. The way the data cells are set up, the way the outbreak control cells are set up, the incident management teams that we support. From a communications point of view, we play a key role in helping those groups to guide the best key messaging to engage with those people that need to be engaged with. It's the district councils who know their communities best, so we've been reaching out through their communications teams, and my colleagues in the communications teams at the district councils work very cooperatively with us. The other challenge we've had is the fast changing nature of the regulations. So obviously with the government introducing new regulations on a regular basis, it's been very challenging having to keep up with that. And as we speak, we're developing communications to go out to say, to address what Councillor Harper raised at the start of his address about the changes, our recommendations in the changes of behaviour in relation to people not mixing with other households. So it's an ever-changing situation. It's a moving target. The data is changing every day, and from a communications point of view, we've achieved a huge amount of engagement in our social media channels, a huge amount of engagement in our website. We have a dedicated coronavirus landing page that has received a huge amount of interest on a daily basis. We have our newsroom where we distribute all our press releases, and we've issued dozens of press releases since the start of the pandemic, responded to hundreds of media inquiries, issued thousands of tweets, and we've been able to provide people with advice about accessing some of our key services, such as the Community Relief Hub, the humanitarian aid group that has been supporting along with the district councils. So we have tried to connect people to the services that they need at the time they need it, using the best of our communications channels and tools, but crucially using the best cooperation that we've got throughout the district and borough councils as well.
Thank you, Luke. I think having looked at the plan that you've put to us this afternoon, very thorough, my question really is regarding, I'm Sarah Collis, I'm the chair of Health Watch Nottingham and Nottinghamshire, and I don't see our organisation represented in your plan as a key stakeholder in the very least. Obviously our role is to very much look at engagement with communities and to be able to offer support and challenge where needed, and I guess I'm supporting challenge at the moment to say that I'd really would like to see Health Watch integrated into the plan and that communication link created, because I think it's something that's been omitted in the response that we've had so far. And obviously we are working very closely with partners across the Health and Wellbeing Board, but we're also working very closely in communities, and we do pick up where things may be not getting through in terms of communication. We did some very early work very early on in the pandemic that highlighted some of the communication from primary care and how that was disjointed in some respects through GPs messaging and answer phone messages to patients. So that was just a small example, but I would like to see us integrated into this plan, please, as I do think it's a bigger mission as the health and social care oversight, particularly on engagement and communication. So that was just my point, Chair. Thanks for letting me make it.
Thank you. Luke, have you got any comment on that?
Yeah, I think it's good feedback. And first of all, apologies, Sarah, for mistaking you for a councillor. But secondly, I will assure you that I will take that away and make sure you're added to our list of key stakeholders if you're not already on there and receiving the regular updates that we send.
Thank you very much.
Thank you.
Thank you. I've got Councillor Fisher, please.
Yes, thank you, Chair. I look at what's in the report, and I just wanted to say again, I probably said this a few times within meetings, but the support that all of the staff at I can only speak for Notts County Council and for Mansfield District Councils. They're the ones that I liaise with the most, but the support, the hard work, and everything that they're doing throughout this pandemic, because it's a massive learning curve for all of us, and for the staff as well, who are doing different jobs to what they would normally do. And I just wanted to raise that point, really, that the number of people that I've come in contact with that have needed support from county over the past 6 or 7 months have all said once they know what they're doing and where to go to, it's been amazing, and they've had phone calls from county council checking on them and things like that, and from district council. So I just wanted to raise that, so it's in the minutes, really, so that staff get to know that it is appreciated, all what they're up to and what they're doing.
Thank you very much. Yeah, if we could include that in the minutes, and it's not just Nottinghamshire County Council, it's all the councils in Nottinghamshire that we're grateful for all the work. Thank you. Thank you for that. I've got Councillor Tideswell, Councillor Wheeler, Councillor Bosniak and Councillor Shaw. Councillor Tideswell, Colin, please.
Yes, thank you, Chair. We have two main concerns in Broxtowe. One is regarding the university, because it is quite close to, and also a lot of the students do tend to come into Beeston. And myself and Councillor Skinner were on a Friday evening collecting the fair trade from the local Tesco, and it was rather discouraging when we noted how many students were coming in, not social distancing and also not having masks. So one wonders whether the communication, the seriousness of the students are understanding, because it does tend to be a little blasé the way they're approaching, especially the way they're mixing in within the community locally in Beeston. And also the other concern we have is when mums, dads, granddads are dropping the infant and junior people off at the schools. There's a lot of adults collecting at the gates and they're not wearing their masks. So I think this is an area we need to look at and see if we can get the heads to either communicate or whether we encourage them to start wearing masks. The same as in the local parks. There's quite a few mums, dads, granddads taking the kids, rightfully so, encouraging them to use the parks and get their exercise. But one wonders whether we should be encouraging the adults to actually wear masks in these situations. Thank you, Chair.
Thank you, Colin. Corporate Director of Adult Social Care and Health, Melanie Brooks, please.
Yeah, I just wanted to mention, Councillor Tideswell, before I hand over to Luke, so just to give you some assurance, so we have what we call an incident management team stood up for each of the universities, because Nottingham University particularly has seen a sharp increase in cases, and that does link in with Broxtowe officers, because we do recognise that there are students who live in Rushcliffe, Beeston and in fact wider areas actually to get affordable accommodation. So I think you're right. I think it is an issue about ongoing communication with all of our population, but we do have some specific focused urgent work that we've stood up last week that the City Council leads because of where the university is located. But we do agree with you, and I'll let Luke pick up the issue about schools because we've had that reported in a number of places, so we would agree with you.
Thank you. Luke, please.
Yes, no problem. Thank you, Chairman. Thank you, Melanie, as well. To Councillor Tideswell, absolutely, it's one of the key issues at the moment in relation to both students and in relation to social distancing at the school gate. The first issue around students, I would just urge caution about messaging, and we've tried to balance the messaging so that we're not seen to be targeting students as being the single cause of COVID prevalence across Nottingham and Nottinghamshire, but actually the community itself is the main area of concern. We work very closely with the university communications teams to make sure that the messages about social distancing are conveyed to the people who need them. And they've got really robust testing strategies within the universities as well. And so it was just to say, absolutely, they are part of they are just one small part of the issue, but by no means the single issue. And we're really mindful in our communications messaging not to come across as targeting students as being the cause of that. because that has caused some issues in relation to their public image, but also when you look at the numbers of community COVID prevalence, at the moment there's no evidence to suggest that it is specifically to do with students causing those spikes, although we accept there are spikes there. So that's the first thing to say. The second thing to say about school gates, I think it's a really pertinent point, and we've been issuing communications through our Email Me subscriber email bulletins. So these are things that people subscribe to through our email subscription service. And we've been sending out regular newsletter updates, namely to families who have subscribed. So these are people who have small children who attend school, and we're asking them to be aware of all the social distancing requirements when it comes to waiting at the school gate. So we are repeatedly pushing that out through our social media channels, through our email subscription bulletins as well.
Thank you, Luke. I've got Dr. Griffiths. Jeremy, is it on this issue, please? Dr. Griffiths?
Yes, absolutely. Firstly, Luke, well done to you and your team. I'm sure you're working like Trojans at the moment in the face of what's going on. I just thought there's a couple of queries really. One links to the point about younger people. One thing I did during the peak of COVID was work with. Oh, can you hear me?
Yeah, you're fine. Yep.
Oh, God.
No, you're fine, Jeremy.
Yeah.
Sorry, can you hear me?
Yeah, you're fine.
Yes,
You're fine, Jeremy.
So, can you hear me?
Yeah.
Yes.
Sorry about that. I'm
right.
getting some network problems. So very quickly, I did some work with a local business, a behavioural science company, and one of the things that we did some research with about 5,000 people across Nottingham, and we found that there was a very different approach to the COVID virus in the different age groups. So the young people are naturally less fearful of the virus, maybe less aware of its wider impact. And I just wondered is there anything that's being done in terms of altering the messages that go to the different. Our campaigns are much more effective in different age groups.
I can answer that, Chairman. Thank you, Jeremy. I think we've lost Jeremy, possibly. I'm not sure.
If you can answer what we've got so far, please, Luke.
Yeah, it was just to reference the fact that we're working closely with the university communications teams, and they drive the campaigns to connect with their students because they're best placed to understand their audiences, and they work with the student unions as well. And we see they're part of as well the local resilience forum communications cell that feeds into the SCG and the TCGs, the emergency planning framework we have in place. So we have good feeds into the student representatives, and we're discussing messaging constantly about how we can change and alter the messaging to target them. But I personally would be very interested in following up on Dr. Griffith's research to see what learning we can share specifically on that.
Thank you, Luke. I've got Councillor Wheeler, Councillor Bosniak, Councillor Shaw. So first of all, Councillor Wheeler, Henry, please.
Hello, hi, can you hear me? Yeah, I just wanted to give some context on schools. I actually work in a school. I'm not going to name the school. I work in a school that's got over 1,500 students in it, okay? Now, I can tell you the reality on the ground. I see it every day. I've been going into school for more than 5 weeks now, okay? So it's like another world, okay? You go into school, it's like another world. It's not like it is outside. You have children, up to 30 children in a classroom sat next to each other, okay? Yeah, right? The other thing is, there is no compulsion in school to wear a mask. It's a purely advisory for staff and for students. And you often find in classrooms, depending on the size of the classroom, that some of those classrooms are quite cramped. And even for teaching staff or other staff, it's incredibly difficult to social distance in a school setting. Okay. Now, each year group is in a bubble, okay, and they're all colour-coded. And I imagine this is the same at other schools as well, colour-coded year groups. Now, as a staff member, staff members work across each year group. So they cross bubbles, Okay, right? That's how it works in school at the moment. The other issue we have in school is that when young people leave site, staff can't be held responsible for where they go when they've left site. Okay, now staff will escort them off site, and parents may be there. We're often having conversations with parents about the social distancing and everything else. But when they leave school site and they go other places and they congregate in the community, because we've had complaints about it, and I know in my borough, in Gedling, for example, we've had to close a facility down because of children leaving school and then congregating in large groups, not social distancing. The issue is children are getting a mixed message because, for example, at a youth centre on a Friday, I came across a lot of young people from another school, not the school I work at, but came along, and we were advising them to social distance, we're advising them to wear face coverings, and they were like, oh, why? We don't need to do that. We're in school, or we're in school, we're in the same bubble, we sit next to each other all the time, constantly, and the issue is how do you get the message across to young people when they're in school in crowded conditions, in crowded circumstances, when staff are also in crowded circumstances, in crowded conditions, having to work as best they can, trying to implement social distancing, which is incredibly difficult, because it is difficult. They try the best, all staff do. The tables, for example, all young people are front facing, so they're all front facing, all in rows. And there's you should have 2 meters between the front where the board is and the first row of tables. But then, obviously, as a staff member, if there's students putting their hands up, asking questions and stuff, you're having to weave in and out and try and resolve issues. The issue is young people are becoming very COVID wary because they're getting mixed messages. Because in school, it's like, we sit next to each other. Outside of school, it's the rule of 6. And as one student quotes to me the other day, and says, well, it's a rule of 6 out of school, but it's a rule of 30 in the classroom, isn't it? How do you change that? How do you educate young people? How do you get the correct message across to resolve those issues out in the community? Incredibly difficult. And my question is how can the county council liaise with school settings, get them to come up with a coherent strategy and a coherent plan around communicating the wider message around COVID, and just how serious it can be for people when, if they become infected, and how that can impact on communities more widely. I think schools need more resources in order to get that message across. I mean, in the ideal circumstance, in the ideal situation, for example, we could have, during the summer, I'm not going to blame anyone for this, but during the summertime, schools could have been given the resources. They could have had additional classrooms put on big sites, because some schools have huge grounds, to allow them to reduce the class size numbers down to a level that's more manageable and more appropriate. But that didn't happen. Well, we are where we are. We have to manage it as best we can. So I'd like the county council, wherever possible, to try and get some messages across to schools to try and resolve those issues when young people have left site. Because not only are young people, when they leave in site, congregate in certain areas, we have young people that are likely to come from, for example, in Nottingham City, we have young people coming from the city of Nottingham into our area. And if there is local restrictions, we need to be able to get those messages across in a way that young people are going to adhere to them. It's going to be incredibly difficult. Thank you.
Thank you, Henry. Luke, please.
Yes, all of that extremely valid, and I'm very grateful for that insight. And as a parent, I can relate to part of that issue, but beyond those school gates, that's where my relationship ends with my children every morning, and I only see there's a small part of the problem at both ends of the day. But absolutely, we work very closely with Colin Pettigrew's teams to try and work closely with, who's got very strong links with the head teachers. But again, I think it sounds to me, from if your experience is representative of other schools across the county, that we perhaps need to up the ante. At the moment, the messaging is very much about, we're broadcasting out to our communities. And I feel now we need to move into more of an interactive stage with our communications and start having the conversations with people. And maybe this is a sign that needs to start to happen. But that's something I think I can take away your insights and use that as intelligence to inform some of the outright communications conversations we're having. but also the wider strategy with our LRF partners as well. So I appreciate the feedback.
Thank you very much. Thank you.
Thank you. Councillor Bosniak, Joyce, please.
Yes, Chair. Just a couple of things. I've just been listening intensely to what Henry's been saying about the situation in the school where he works, and I think that can be replicated across Nottinghamshire, except for I'd say that perhaps in the primary schools things seem to be a little clearer to the pupils. My two grandchildren tell me what I should be doing, so obviously the message is sinking in. But I've also witnessed the congregation outside school gates and parents not wearing masks. However, I think we've got an uphill struggle really with the schools, particularly the secondary schools, as the vast majority of them now are all academies, and we have no real control and power within that school except for advisory. And I know that Marion Clay from Children's Services has been working really well and has developed a really good relationship with a lot of the schools. But clearly there's a lot more work that needs doing. But I also think that you touched on something about confidence and public confidence, and our young people can see the hypocrisy that is being played out. And they're not afraid of telling us about it either, as you well know. And I do think that the role that we have as councillors, both county and district, is to help try and do something about that public confidence that has quite frankly taken one hell of a kicking of late. And I think that's the role that we can play. So within your report, Lou, within your strategy, we do talk about intelligence gathering. And I do think that your greatest asset is both county councillors and district, although your plan seems to talk more about what the districts can do. And it's a two-way thing. You're right to say it's about being interactive, because we can all gather the information, but we can also disseminate that information as well to our local communities. So just to say, in the same way that Sarah was saying, not putting community health on there is a big mistake. I think lots of people can look at it and give you some advice about who else should be included. But I think all district and county councillors are an asset that we should be utilising perhaps more fully than we do already. Thank you.
Thank you, Joyce. Just as a matter of record, I found the exact same situation as yourself with primary schools. I'm a governor at a primary school and they know all about it, and they tell you about it as well. So I've had that same experience. Luke, please.
Yes, it was just to say thank you again, Councillor Bosniak, for that excellent feedback. I think the learning here is that we need to share some of our intelligence locally, more centrally with the regional public health teams as well as nationally, so they can start to understand the picture across the county as well. So I'll take that away and we'll add that into the conversations we're having to reinforce that strategy.
Thank you.
Thank you, Luke. I've got Councillor Shaw. Susan, please.
Oh, hello. Yeah, I wanted to say thank you, Luke, as well. I thought your commentary around your strategy was really good. I mean, it will be great to see more, and not anecdotal, but next time if you'd be invited back to give us a broader idea of what you're doing. But we do know from Bassetlaw and the partnership work in Bassetlaw and what you said about districts knowing their residents is hugely important, and I really Bassetlaw really value that joint working that you're doing with the comms in Bassetlaw. And also I think it's really good to have a level of knowledge and understanding that is absolutely for our residents, and so I really appreciate that, and I know we all do. We were only talking about it on Monday, the way that the cabinet about how you and our comms are working together. And I have to say, you're all there's certain departments within the districts and county that are punching way above their weight, and it's a wraparound hug for you guys and girls that are doing the amazing work, and it's not going to stop. So a big up to communications, really. Thank you.
Thank you. Luke, did you want to comment on that one?
I'm not sure what to say to that other than thank you. On behalf of all of my district council colleagues and my communications colleagues at the county council and the city as well, this is the biggest challenge we've ever faced in our professional communications careers. And I think we're having to evolve and innovate every day to try and do things differently. So that feedback is enormously welcomed, and I'll pass that on. Thank you.
Thank you. Councillor Tideswell, Colin.
Yeah, thank you, Chair. I would like to concur with what Dr. Gribbins was saying. I know whilst we were studying Tesco, there was one group from one of the Asiatic countries, actually. They were the only ones that came in and were social distancing and wearing masks. So that is the reason why I would concur with what Dr. Gribbins was saying. It definitely does seem to be like age-related and also depending on the attitude and aptitude of the students. So I think was very succinct of what you were saying. Thank you.
Thank you, Colin. Luke, do you wish to come back on that one?
No, nothing further to add. Thank you, Chairman.
Thank you. Dr. Griffiths, you're back on board again. Did you want to speak again? Dr. Griffiths?
Yeah, sorry, I completely lost the signal before when you were answering, Luke, about the question. I just wonder if you could just succinctly let me know what approach you're taking to essentially sort of granulate your communication into different bespoke populations, because we've clearly got to get penetration into certain groups. Because there are disproportionate groups that are now currently being affected by this current outbreak.
Yes, I think the first thing was to say is that thank you for the insights from your research project, and I'd be certainly interested in seeing the results of that so we can take some learning from it, and that might in itself help us to make those more granular and targeted communications to those particular groups. So we have specific channels available to us through online, social media, print and outdoor or print media as well. What we don't have is the hyper local targeted communications channels that might help us to understand some of the more very specific targeted groups that we need to meet. So I'd be certainly interested in speaking to you and exploring that further to see how your research could inform what we can do to target some of those messages in a more granular way as you described.
Yep, happy to do so.
Thank you. Thank you very much, Luke. It's been very interesting. You've fielded a lot of questions there, and I'm sure you've had a lot of feedback to work on. So you've got some raw data now to work on. So thank you very much, and hopefully we'll see you at a future meeting. You're more than welcome. Thank you.
Thank you, everybody.
I've already read out the recommendation. Anyone against the motion? Anyone abstaining? In that case, I will assume assent. Thank you very much. Thank you, everybody, for all your input into that subject. We'll move on to item 6, which is the review of the Better Care Fund programme and use of Better Care Fund reserves for short-term transformation projects. And you'll find the details on page 27 to page 50 in your agenda packs. The recommendations are to approve the Nottinghamshire Better Care Fund Q4 reporting template that was submitted to NHS England, an improvement on 4th of September 2020, and 2, to consider the actions underway to progress the recommendations approved by the Health and Wellbeing Board on the 24th of July this year to implement the Better Care Fund review and utilise Nottinghamshire County Council's Better Care Fund reserve. So to debate it, I'll move it. Could I have a seconder, please?
I'm happy to second that recommendation, Chairman.
Thank you, Councillor Rostance. Claire Gilbert, Nottinghamshire County Council's Group Manager for Strategic Commissioning, will provide an overview of this item. This includes updates on the Better Care Fund for Q4, progress of the recommendations that were agreed by the Health and Wellbeing Board on the 24th of July, and the Better Care Fund Section 75 agreement. So in line with recommendation of 1 of the report, we'll be asked to retrospectively approve the Nottinghamshire Better Care Fund 2019 to 20, the reporting template which will be discussed. Claire Gilbert, please.
Hello there, Councillor Harper. Thank you very much for inviting me here today. I think, to be honest, you've covered largely what I wanted to sort of highlight for today, and I know you've got a very busy agenda. So it was really to just bring in front of you, obviously, the formality of signing off the Better Care Fund. I mean, this dates right back to Q4, so the January to March of this year, and obviously that sign off was delayed at a central government level because of COVID, and so there was a long delay before the paperwork came out for that. This was signed off in the absence of it being able to come in front of the Health and Wellbeing Board by yourself and Melanie Brooks and Amanda Sullivan. And so this is just sort of the final rubber stamping of it that needs to come in front of you today. We're still awaiting the template for this year's Better Care Fund from central government. So although we're obviously sort of more than halfway through the year, we still haven't had the 2020-2021 template yet submitted, but we are anticipating it any day now, and we expect it's going to be a very, very light touch document, much as the Q4 sign off was. So that's sort of the formality part of the paper. The other bit is just to briefly update you. As you will be aware, back in July, a number of proposals were brought to this board to look at a change in the way that we oversee and the governance of the Better Care Fund, and the dismantling of the current steering group, and its place to put two groups in place. One of them to look at the kind of housing components of the Better Care Fund. Increasingly, housing is being recognised as a core function in the delivery of health and social care, and is being recognised now in some of the metrics related to the Better Care Fund. And so it was felt that it was important to have a group that kind of looked at the housing components of that part of the fund, and then a more generic group that would really be the place where we would showcase integration that is happening across the system and champion it, and be the place where that integrated work is happening. And I think obviously all the work that's been happening through the LRS and COVID has been a key example of some great examples of integration, and it's how we kind of capture and make sure that some of that work isn't lost going forward, to ensure that we continue to deliver against that agenda. So as part of the process of moving towards this new structure, the plan is to have a workshop with yourselves in December, and we're kind of working out what that will look like to kind of pick up some of those issues and to set the vision and principles that we want for those groups. So that will kind of, set the underpinning for that work, and then to kind of, from that, to make sure that the groups are sort of up and running. I think we would hope to have them in place prior to that date, but then for that to help shape the form of them going forward. And I think, as also Councillor Harper referenced, the Better Care Fund is delivered through a Section 75 agreement, and that has been updated in light of the current PCF. So I think that was all I had to say in respect to the paper.
Thank you very much, Claire. Anybody like to make a comment or any questions, please? No? Thank you very much. Thank you very much, Claire. Thank you for that report. It was obviously very comprehensive, because you haven't got any questions to answer, so that's good. Anyone against the recommendation, which has already been read out? Anyone abstaining? Therefore, I will assume consent. And we'll now move on to item 7 on the agenda, which is the work programme. And the recommendation is that the Health and Wellbeing Board's work programme be noted and consideration be given to any changes which the board wishes to make. We'd like to draw your attention to the board's work programme, as can be seen on page 58 of your papers. Our next meeting will take place on Wednesday, 4th of November. The date after this, Wednesday, the 2nd of December, will be our first workshop since the pandemic. If you remember, since the summer, we've needed to get business meetings done as a priority, and then we said we'd revert back to the workshops. And the Wednesday, the 2nd of December, as with our current meetings, will take place virtually. The subject will be on the review of the recent review of the Better Care Fund, agreeing the visions and principles to guide our integrated approaches for health, care and housing in Nottinghamshire. COVID-19 will continue to demand significant resources from our retrospective organisations. And there are a number of items we have not yet been able to reschedule as yet. These are listed on pages 9 to 10. We'd like to reassure members that work is underway to identify timescales for these items, and these will be brought to the board as soon as is appropriate and feasible to do so. Would members like to comment or request any changes to the work programme before I bring Ed Shaw in, the Corporate Director of Adult Social Care and Health? Melanie Brooks, please. You're muted, Mel.
Yeah, I think it's going to be to extend my apologies for the fact that we're not, as a council, going to be able to prioritise Health and Wellbeing Board business. So, as I'm sure you've seen in the media, Nottingham and Nottinghamshire has seen a sharp increase in the cases of COVID. This was news to us because it was partly related to the gap in data from Public Health England. So we didn't have the usual run-in to understanding when we needed to stand up a public health response. We did so yesterday, so officers from all of our organisations were involved at a senior level in a Nottinghamshire-wide incident management team, and unfortunately that is going to be our focus for the coming weeks, if not months. So we are going to be reviewing the work programme, and we'll need to stand down a number of items. So I think please consider, if you're asking for updates, if there's pieces of work, I'm afraid I'm going to have to be quite brutal when it comes to agreeing whether we can resource it from a public health or adult social care perspective, but public health particularly. So like I say, it's just we're having to prioritise to the emergency. So please bear that in mind. So the work programme as it stands, I'd be expecting to negotiate with the chair outside. So clearly we stood the IMT up yesterday. When the papers went out, we thought we're in the process of recovery from COVID, and we're clearly not as a county.
Thank you, Mel. Thank you for those important details. Ed Shaw, please.
Hello all. It was just to say I've made a note of the two requests made earlier in the meeting. One from Jeremy Griffiths about Nottinghamshire Connected, and also Luke Barrett's offer to come back to a future Health and Wellbeing Board meeting. So with Melanie's comments taken into account, I will be in touch with both Jeremy and Luke to look into what might be feasible on those items.
Thank you, Ed. Anyone else got any comments or anything that we've missed out that you want to include in the work group? This is your ideal opportunity to put things in the work programme, bearing in mind the comments that the Corporate Director of Adult Social Care and Health has made. Thank you. Anyone against the recommendations? Any abstentions? Therefore, assent will be assumed. So thank you everyone for attending today's meeting. Sorry it's been shortened, but unfortunately circumstances dictate. We've got frontline staff that need to be on the front line at the moment, as I'm sure we all understand. And thank you for the health people, the doctors and everyone else that's took time out of their busy schedule. We will try and keep something going on health and well-being, but obviously circumstances dictate, and certain circumstances are out of our control. So unfortunately we will have to work at a reduced capacity, but we will still be here. We will still be sending out the updates, and we will be keeping everyone informed. So thank you very much. We look forward to seeing you at the next meeting on Wednesday the 4th of November at 2 p.m. Sorry, Councillor Bosniak. Joyce, please. You're muted, Joyce.
That's usually a good thing, I'm told. People throughout this meeting have been thanking everybody, every partner, every member of staff, every officer across Nottinghamshire. And rather than attribute that thank you to one individual, I think it needs to be a collective thank you from the Health and Wellbeing Board. So I just think that would have more strength, and I think people would appreciate that big thank you.
Thank you, Joyce. That's really important, and it's good to show a unanimous joint big thank you to everyone involved for all their hard work in Nottinghamshire. And when you speak to people in Nottinghamshire, they are receiving good care, they're receiving the health that they need, and it's testament to all of our hard workers in this county. Thank you very much, Joyce. Could I have that in the minutes, please? Thank you. Thank you, everybody, and we'll see you at the next meeting. Thank you. Goodbye.
Thanks, Tony.
Thank you. Bye.
Thank you.